Hello and good evening. I'm Melissa Idris.
And I'm Sharad Kuttan.
Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Our guest today is Palani Narayanan. He is a senior advisor on drug use and harm reduction at the Global Fund, which is an international financing body that invests in efforts to defeat HIV, tuberculosis, and malaria. He's also the co-founder of the Ikhlas Center, which was Malaysia's first harm reduction program for sex workers and drug users. And he's also the founding chairperson of the Asian Harm Reduction Network from 1997 till the year 2000. Palani, what a pleasure it is to have you back on the show. Welcome back, and thank you so much for joining us today.
Oh, thank you very much for having me back. That's a real honor.
Well, Palani, when we last spoke, the last time you were on the show, you had mentioned almost in passing about that Malaysia's war on drugs had failed. And I was wondering if we could begin our conversation there. I mean, Richard Nixon had started the war on drugs in the 70s, but maybe you can help us understand what those decades have done. I mean, the history of it in Malaysia and the human cost it's taken a toll on.
Sure. The history of war on drugs itself is really interesting. If we look back at history, we find that communities in our region, in the Middle East, in Africa, have all used drugs in their daily lives for traditional, cultural, medicinal, ritual purposes. But then colonizations happened, and then colonial powers came about, and then drugs were demonized by these colonial powers in lower middle income and countries which were colonized. Then came the US as a global superpower, and with that came Richard Nixon and his war on drugs in 1970, 1971. And what the war on drugs has done around the world has been the increase in the number of people in prison. So right now in prisons, we're seeing the rate of prisoners increasing everywhere around the world, including Malaysia. Women who are in the prisons have increased 50% just in the last 2 to 3 years. We see communities disintegrating due to the illegal business and the criminality and the criminal business, criminal aspects of things. We are seeing people carrying the brand of being prisoners all their lives. And we're seeing increase in infections such as HIV, tuberculosis, hepatitis C. The war on drugs, which has costed countries millions and millions, if not billions, every year, each country spends hundreds of millions, including ours, Malaysia, spends hundreds of millions in the interdiction, in trying to stop the production, in trying to stop the distribution of these drugs. For the benefit of the Malaysian society, but in fact, what we see is quite the opposite. What we see is an increased number of people getting infected with HIV, infected with different diseases, and increase in prison systems, and their lives being spoiled for the rest, carrying the stigma of a criminal. So the war on drugs has not contributed to the health and well-being. It hasn't. Okay. It has in fact been a racist and colonialist tool to control a certain population, and particularly affected are those who are marginalized and poor.
Palani, maybe we could get some definitions here about the question of what are we talking about when we talk about drugs? Because there are all kinds of pharmaceuticals that are legal, then there are the not, and then there are definitions around recreational drugs and soft drugs and hard drugs and so on and so forth. And what was traditional doesn't exhaust the new forms of drugs that have come to dominate landscapes. Like Yaba, I think, is one of the new drugs, or maybe not so. So if you could help us understand what are you referring to when you speak about drugs, and how do we differentiate policy responses based on that categorization?
Yeah. Yeah. So that's a really great question. I think one thing to add is that, every year what UNODC, the United Nations Office of Drugs and Crime, puts out the World Drug Report. And I strongly recommend us to read the World Drug Report. And if we read that, you will see that the number of countries reporting drugs in their country, or reporting the number of people using drugs in their country, and reporting the number of people injecting drugs in their country, increasing. We see that if we put the reports side by side, every year you will see it's increasing. So the number of people is increasing. The type of drugs that are being used in the world is also increasing. So it's a real interesting question about drugs. When you say drugs, anything that you put into your system that changes your central system is called drugs. Then you have narcotics, which are essentially drugs that are psychoactive, that has an impact on your central nervous system, and those which have been made illegal. So the question around why are some drugs legal, some drugs are illegal, is a really good one, but that takes, for us to discuss why countries have these policies. But then the United Nations and UNODC and World Health Organization also have different schedules of drugs. Schedule 1, Schedule 2, Schedule 3, according to the severity of the dependence to that drug. Now, but just to say, number one, we have cigarettes and alcohol, which are far more dangerous to health, and we know have got addictive qualities, which are regulated and taxed. And then you have other drugs such as heroin and marijuana, which are heavily criminalized, not regulated, and you get death sentence if you're caught with a small amount of it. How do you make sense of these from an addiction or a public health perspective is a really difficult one. Then you talked about crystal methamphetamine, yaba, that has flooded the markets in Asia, for example. And this is another struggle that we have to control. These drugs can be made in the kitchen, in somebody's sink. And therefore, the production is easy, the distribution is easy, and we find it really difficult to control or to regulate or to reduce its demand or supply. So so drugs have got different schedules. The easiest way to understand them is uppers, those that make your central system more active, or downers, which are suppressants, depressants, such as heroin. And then you have the psychoactive ones, the psychedelic ones, which are like acid, for example. So you have different types of drugs, different schedules of drugs, and different responses to these drugs.
Okay. Palani, it's been half a century now since the first war on drugs that Nixon introduced, and I'm just wondering, 50 years down the road, has it changed? Have global attitudes towards drug policies and the impact of this war on drugs has had on people? Has the narrative shifted?
Yeah, it's shifting. It is shifting. I think we've had 50 years of this. Many countries have adopted the war on drugs simply because it's convenient. It makes the public feel safe. The narrative that the governments have always provided to the people is drugs are really dangerous. If someone in your family takes drugs, you don't know what to do with them. Send them to us. We will put them away, and then you are safe and the society is safe. This is the narrative that we have provided to the society. And for 50 years, we've brainwashed our communities to think that drugs are so bad that if you have someone who uses drugs, they need to be put away. That narrative is wrong and is changing. So more and more countries are realizing that putting people in cages, i.e. prisons, is not the best way to go. It's only good for a certain number of people, those who run the prisons, those who are engaged in prison services, those who are engaged in rehab services. It's only beneficial for a few. But in fact, the lives of the people who use drugs or are affected by drugs is not useful, it's not beneficial. So you see a range of countries moving away from the narrative of war on drugs. You saw it recently in the toughest country like USA. States have started to legalize marijuana, both medical marijuana and recreational marijuana. The state of Oregon, for example, in the United States, have gone all out and decriminalized all drugs. This follows the European example where the European countries are decriminalizing all drugs. Portugal, for example, has decriminalized all drugs for personal use and possession. This means if somebody carries with them a small amount of drugs and are using drugs, instead of going to the prison, they are given a civil sentence where they can go to a prevention prevention and treatment committee to get assessed for their drug use and then sent for treatment. So such diversion policies, decriminalization policies is going through the world at the moment. People are realizing more and more that the narratives provided by the war on drugs has also failed.
Okay, wonderful. Palani, we're going to take a quick break, but let's come back and continue this conversation in a couple of minutes. Stay tuned to consider this. We'll be right back. Hi, thanks so much for staying with Consider This. I'm Melissa Idris. With me is Sharad Kutan. Let's continue our conversation with international harm reduction expert Palani Narayanan. He's with the Global Fund based in Geneva, which I understand is very cold today. Sharad, you had a question?
Just to warm the cockles of your heart, Palani. In 2018, at least for a lot of us, I think, were concerned about this issue. The then government, Pakistan Harapan, opened up the conversation around decriminalization, and one of the arguments they made was the need to decongest our prisons. Our prisons are overfilled beyond capacity. Many of the people who are in prisons are there on minor drug offenses. The drug offenses, we also understand, and the whole system around it, as you put it earlier, Palani, really benefits a few. A lot of corruption in enforcement and the ability to make people vulnerable leads to all kinds of extortion type practices as well in society. So there were all these really great arguments, and that conversation seems to have stalled. Except currently it's been brought up again by I think Azalina Osman Syed is the MP pushing this argument. Where would you like to see Malaysia go? And what do you think we should understand about the nature of the problem? Whether it's substance abuse, use of substance for recreational purposes.
Yeah. I think we need to frame this in a number of different perspectives. Number one, we need to decolonize the world's drug policies, and same thing with Malaysia. This war on drugs is not indigenous to our country. We have had drugs being used in the country, including what is hot topic at the moment, katum. Was traditionally used in the northern states for people to feel better and to work, to help them to sleep, all of that. And yet we have also put that as forbidden. It's also under the Poisons Act, and we are talking about whether it should be legal or illegal. Same thing with all other drugs. I think where we need to be is leave that mentality that everything needs to be criminalized and using punitive approaches of putting people in prisons, and think more progressively around what can we do that would benefit the society, the people who are using and affected by these drugs. So if we think about it that way, then the best way to do things is to regulate it. When you regulate a certain drug, let's say ketum or marijuana, what you are then able to do is that you're able to regulate or control the production, whether it's the plantation or the production of the product. You're able to control and look at where and who is using, how it's used. You can control the commercialization of the product, and you can also provide treatment for those very small percentage of people who misuse the drug, right? So you can actually provide services along the entire spectrum from production to use to misuse. You can provide services for that. And you can also save a lot of money by taxing, by production and sale of the medication, and by reducing the cost of policing, reducing the cost of prisons, reducing the cost of mandatory treatments. When you can save a lot more money by regulating a drug than making it criminal. And criminalizing this, the cost of criminalization is very, very high, from interdiction, from policing, from prisons, from mandatory treatment. All of that costs a lot more money than if you regulate it and make it come above ground.
Okay, so if I understand correctly, what you're saying, prohibition doesn't work
No,
in stemming drug use. So we should be thinking about decriminalization along with legal regulation and harm reduction policies. Is that accurate to
absolutely.
say? Okay.
Absolutely.
Can I
We
ask you,
can,
Palani, then? Yes. Sorry, you say?
no, I was going to say that, the amount of money that we spend on drug law implementation, such as policing and interdiction and customs, the amount of money we spend on that is perhaps 1,500 times more than what we spend on prisons, on treatment and prevention of these drugs. So if we can just move even 10% of the drug control money to harm reduction and treatment programs, we would be doing a lot better than just doing drug control. The Malaysian harm reduction program since 2005 to 2015 reduced the rate of HIV in Malaysia from 70% to somewhere around 11%. Within just 10 years, we managed to reduce HIV by doing harm reduction program. So the proof is there. Now it's just the courage to do the right thing. Sorry.
Yeah,
No,
courage is an interesting thing, Palani. The courage has to come from our parliamentarians and our political leaders. It's a political hot potato. You know this, I know this. There was a time when harm reduction was something that was farmed out to NGOs because government didn't want to touch it. They didn't want to be associated with needle exchange. They didn't want to be associated with condoms. Something as simple that saved lives. Politicians were too cowardly to put their names to it. And that is basic fact of public policy in this country. How do we get over this? How do we create the pressure for pragmatic policies in this country that are not taken over by demagogues and moralizing that comes out from?
I think absolutely, Sharat, absolutely. I think the first thing that we must remember is politicians follow what they think people want. And 50 years of brainwashing means that still a lot of people think drugs are the #1 enemy, and the only way to deal with drugs is by putting people in prisons and getting rid of them. That's what a lot of people still think, because that's what we've been fed for 50 years. So what we are doing today, talking to the Malaysian public and explaining these things and getting people to think differently, is going to be the number one thing that's going to shift the ground. We need to start from ground up. So that's why people, our groups in Sharia, the different community, civil society organizations that are working on legalizing medical marijuana, all of them are going out there and speaking to the public. So we need a lot more public discourse around this. We need a lot more media information around this. We need to tackle the Malay media in the country to discuss this a lot more, because people know, they have seen their children go in and out of pusat serentis, like, in their lifetime, like 8 times in and out, so they can see the impact that it has done. So that's number one. Number two is, I think we are seeing a group of very courageous parliamentarians starting to build caucus. There is a bipartisan caucus on medical marijuana that is started by Syed Siddiq and his and a number of parliamentarians. We need to support them. We need to find ways of supporting them with the right information, research, data, so that the caucus can build better proposals for law reform. We need to look at the laws that are impeding this process. So the Akta Dada Berbahaya needs to be reformed. We need to think about, okay, which are the exact laws and how do we change those? So the work is on many, many fronts. And I can let you know that there are many concerned parties in Malaysia who are starting to work on this, who are discussing this with different areas. So I'm optimistic. I'm optimistic that we actually are shifting the needle on this topic in Malaysia.
Okay, so you talked about all the different aspects, Palani, about what it takes to shift that needle, and I'm just wondering, in terms of capacity building, so
Yeah.
you would need to build capacity to ensure we are on that there's a roadmap, that we're on that journey. What is needed for capacity building so that we can achieve decriminalization, regulation, harm reduction, and all of those, doing away with our punitive drug policies?
Yeah. So the first capacity building we need, I think a lot of our policymakers are still wary about regulating and decriminalizing drugs because they haven't seen it working. It's always a really big jump to go from, let's control this as much as we can to let's decriminalize this. Even when I speak to my people close to me, my family and friends, people have questions like, but if you open it up, everyone will start using. Then everyone will be, high. I know that that's what people may think, but it hasn't happened like that. In every country that has decriminalized drugs or has legalized marijuana for recreational use or medicinal use, people haven't gone out there being high and not doing their work and getting into accidents. That hasn't happened. People still have families, people still have jobs, people still have responsibilities that they take seriously. It is only in all of these drugs, only 10% of people go on to become dependent and have problematic drug use. Now, people need to see this. Our politicians need to see this. So we need to support our politicians and our policymakers to look at this in other countries such as Thailand, which has legalized medical marijuana, such as Portugal, which has decriminalized all drugs. So we need to capacitate our policymakers. We then need to capacitate our community leaders, such as religious leaders, ex-drug user organizations, youth groups, and women's groups. We need to educate these community leaders to see things differently, to see it from a different perspective, to consider this, to consider that war on drugs hasn't worked. Maybe we should go the other way, because if we are investing in the same thing that doesn't work and expecting a different result, it ain't going to work. we need to find something else, right? So we need to educate then our the people in the rural areas, because they vote and they may not have access to the things that we are talking about. So we need to capacitate our medias that write in Bahasa Malaysia, and which is read by people in rural areas. Those are the kind of capacity buildings we need to do.
Thank you so much, Palani, for giving us something to consider tonight, leaving us with that. Thank you for sharing your insights. That was
Thank you
our
very much for
conversation.
having me.
That was our conversation with Palani Narayanan, Senior Advisor on Drug Use and Harm Reduction at the Global Fund. That wraps up this episode of Consider This. Thank you so much for watching. I'm Melissa Idris.
And I'm Sharad Putin, signing off for the evening.
We'll catch you same time tomorrow. Good night.